Before understanding the process of healing of a fracture, we need to have the concept about two types of bones. And these two types of bones are classified on the basis of maturity, or you could also say on the basis of arrangement of collagen fibers. The reason we need to know these two types of bones is because during healing of a fracture, first immature bone is formed, and then this immature bone is substituted by or replaced by mature bone. So, on the basis of maturity, we have mature bone and immature bone, where in a developing bone, immature bone is formed first, which is then replaced by mature bone. Mature bone is also called lamellar bone because the matrix of the bone is arranged in lamella or plain sheets, and individual sheet contains collagen fibers that are arranged in a parallel fashion. Similarly, immature bone is called woven bone because the collagen fibers found in bundles are arranged in a randomized fashion. There is no regular fashion of arrangement of collagen fibers, they are completely randomly arranged. So, let's say a bone has just been fractured. At the site of fracture, different processes will go through, and one of the process is obviously the reformation of the bone itself. During that process, firstly the immature bone is formed, which is the woven bone, and the woven bone gets eaten up and replaced by newer mature bone, which is lamellar bone, cause the woven bone is possesses less tensile strength or has less strength, while lamellar bone is much more stronger. There are two ways fracture can heal, and this depends on the presence or absence of movement at the site of fracture. Let's say there's a long bone, and this long bone has been fractured at a particular site. There can be two conditions. In first condition, let's say the doctor simply applies maybe a splint or a tourniquet or a bandage to hold the fractured parts in a place or to provide stability to the bone. However, there is still space at the site of fracture between the two fractured parts of the bone. There is still space, and due to this space there is still movement between the fractured parts of the bone. And if there is movement at the fracture site, then the healing of the fracture takes place by secondary intention. Secondary intention of healing a fracture is basically the natural way a fracture would heal. Basically, the natural healing of fracture is what we call healing of fracture by secondary intention. And during this healing, formation of something called callus takes place, as well as it goes through intermediate stages, or the fractured site goes through multiple stages before it gets completely healed up. Second condition, let's say a long bone gets fractured at a site. Now, instead of applying simply bandages, splint, and tourniquet, what doctor does is that surgically operates on the bone, applies nuts and bolts, maybe stabilizing plates, to keep the fractured parts of the bone together, to hold them together, to stabilize them together, so that there is rigid fixation. The fractured parts of the bone are kept close to one another, held together, and rigidly fixed using knots, bolts, plates, and everything surgically operated upon. As a result, there is no movement at the fractured site. And if there's no movement, then healing takes place by primary intention. In primary intention, there is no or very little formation of callus, and it is much more faster than secondary intention. The reason being, in secondary intention there is gap, and this gap first needs to be filled. For that, the process goes through multiple phases. However, in primary intention there is little or no gap at all. As a result, the the healing process takes place much more faster without having to go through many stages. First, let's learn about healing of fracture by secondary intention, because this is the one that is most often seen, does not require any surgical intervention, and takes place naturally. Since it takes place naturally and does not require any surgical intervention, it takes a much more longer period of time as compared to healing by primary intention. In secondary intention, there are altogether 5 overlapping stages, and they are: number 1, hematoma formation; number 2, inflammation; number 3, soft callus formation; number 4, hard callus formation; and finally, number 5, remodeling. So, the first step is hematoma formation. I have a long bone right here which has been fractured at this particular site. Then the blood vessels supplying this bone at that particular site also get ruptured. After the rupture of the blood vessel, what comes out? Blood from the blood vessels come out and fill the gap between the ruptured part of the bone. This right here is what we call a hematoma. However, the hematoma doesn't just stay as it is. Immediately, the process of blood clotting starts due to platelets, obviously. And during clot formation, fibrin forms a meshwork around the fractured site. So, fibrin, it forms a meshwork around the site of fracture and holds everything together, and holds the fractured parts or the fractured ends of the bone together, provides little bit of stability. So at the site of hematoma formation, macrophages, they appear and induce the process of inflammation. This right here is the same broken bone, but I have kept it horizontally. So here's the broken end of the bone. Here's one end of the broken bone, and here's the other end of the broken bone. The bone is covered by periosteum. Okay, so at the end of second stage, that is inflammatory stage, what do we get? We get platelets that were responsible for the formation of fibrin meshwork that held, or that is holding, the two ends of the broken bone together. And then as well with that, we also had inflammatory cells that were responsible for inducing the process of inflammation. Now, the same two cells, that is the platelets and the inflammatory cells present at the site of injury, produce growth factors. These growth factors, they are responsible for activating stem cells present in periosteum as well as endosteum. So there's your progenitor stem cell of the periosteum. This progenitor stem cell, once they receive these growth factors, they get activated and convert into two important cells, and they are osteoblast cells that are responsible for forming osteocytes or bone cells, and chondroblast cells that are responsible for forming your chondrocytes, which are cartilage cells. Along with those, you can also see fibroblast cells here and there. These fibroblast cells, they are responsible for the secretion of collagen fibers at the site of fracture. Okay, then what happens? Here's what happens. At the site of fracture, you can see certain things. You can see these macrophages, which were the inflammatory cells inducing inflammation. So we have the macrophages. We also have new capillaries forming, proliferating capillaries. These are capillaries that are forming on their own, and they are newly made proliferating capillaries. We also have these fibroblast cells that are secreting collagen fibers, fibroblast cells. These three elements together is what we call a granulation tissue. So granulation tissue is composed of macrophage, proliferating capillary, and fibroblast. So at this site, the formation of granulation tissue takes place. However, the fibroblast of the granulation tissue is secreting fibers, collagen fibers, and then There are also chondrocytes, right? Chondrocytes formed from chondroblast. And these chondrocytes, they are also responsible for the formation of cartilage. So what happens is that cartilage along with these collagen fibers, they replace the granulation tissue. The granulation tissue gets replaced by fibrous connective tissue along with cartilage. Fibrous connective tissue secreted by the fibroblast cells and the cartilage formed by the chondrocyte cells formed from chondroblast cells. These two together form a sticky area at the site of fracture that properly hold the two ends of the fracture together. And this sticky site that we get is what we call the soft callus. So soft callus is composed of cartilage. The cartilage now has to go through the process of ossification, which can either be endochondral ossification or membranous ossification depending on the type of bone and the site of injury. However, during the process of bone formation or during the process of ossification, initially immature bone is formed. And this right here, which is woven, is the immature bone, which is also called woven bone. The woven bone further goes through the process of mineralization to finally form mature bone, which is also called lamellar bone. Lamellar bone is much stronger than woven bone. And this is how formation of hard callus take place. Finally, remodeling. The lamellar bone that is present at the site of fracture acts as a bridge between the fractured parts of the bone. This lamellar bone go through reshaping to finally form a much healthier, much stronger, and much stable bone. For that, it goes through the process of remodeling where the lamellar bone gets continuously eaten up as well as reformed again and again. That is, there is continuously bone resorption, that is eating up of bone cells, and formation, that is new bone cells are formed. There is osteoclastic and osteoblastic activity taking place at same time. By osteoclastic, I mean the eating up of the bone. It's the same as bone resorption, and osteoblastic activity refers to the formation of new osteocyte or new bone cells, which is the same as formation of bone cells. So let me revise the whole steps of secondary intention of fracture healing in short. First, we have hematoma formation. At the site of fracture, blood vessels get ruptured and blood comes out of blood vessel forming hematoma. So this is hematoma. At the same time, there are also platelets that contribute in the formation of a meshwork of fibrin. This fibrin wraps around the site of fracture and hold the two fractured parts or two fractured ends together. Provides very little bit of stabilization. Second stage is inflammation. So there is influx of inflammatory cells like macrophages that induce the process of inflammation. So there's hematoma formation followed by inflammation. So we have platelets that helped in the formation of meshwork of fibrin, and we have inflammatory cells that induce inflammation. Along with that, these two cells have another function, that is, they secrete growth factors. These growth factors, they are responsible for activating the progenitor stem cells, which get activated into osteoblast cells that form osteocytes or bone cells, and chondroblast cells that form chondrocytes or your cartilage cells. Along with that, there are also fiber secreting fibroblast cells here and there. And then there are also capillaries that are proliferating or new capillaries that are being formed. So what does it look like? So we have fibroblast cells that are secreting collagen fibers. We have macrophages, and then we have these new proliferating capillaries. These three stuffs, that is macrophage, proliferating capillary, and fibroblast, together forms granulation tissue. This granulation tissue gets replaced by the collagen fiber being secreted by your fibroblast as well as the cartilage formed by chondroblast. So we had granulation tissue. This granulation tissue gets replaced by fibrous connective tissue secreted by fibroblast and cartilage secreted by chondroblast. These two together form a sticky site at the site of fracture, which properly holds the ends of fractured parts together. And this sticky site is what we call soft callus. Soft callus contains cartilage. This cartilage goes through the process of ossification to form hard callus. However, initially the type of bone formed by the process of ossification is the woven bone, which is the immature bone, which continues with the process of mineralization and finally forms your lamellar bone, which is much more stronger. The lamellar bone acts as a bridge between the fractured ends of the bone, and this lamellar bone goes through continuous process of resorption and formation, that is osteoclastic as well as osteoblastic activity, to finally form a newer looking, stronger bone. And this process is what we call remodeling. Remodeling is something that takes place continuously in your bone naturally. Right here, it's taking place in order to restore the ability of the bone. In primary bone healing, the fractured ends of the bone, the fractured ends of the bone, the fractured ends of the bone are brought close to one another with the help of surgery, where fixating plate, knots and bolts, etc. are used. In this particular condition, a rigid fixation is brought between the fractured ends of the bone, due to which there is either very little gap or no gap at the fractured site at all. No gap at all or very little gap. When there's no gap at all and the two ends are in complete contact with one another, the type of primary bone healing taking place is contact healing, where there are no intermediate stages. The bone heals directly, no intermediate stages appear, or there are no intermediate stages at all. But if there is gap, then the type of healing is gap healing, which is of two types. If the gap present is narrow, very narrow, then direct lamellar bone formation takes place. But if the gap is comparatively wider, then first woven bone formation take place, then that gets replaced by lamellar bone. But remember, even this gap is very less as compared to the gap that is present during secondary intention healing. During that, there is quite a bit of gap. But here, with the help of surgery, the gap has been reduced immensely. But still, if there is gap, then gap healing will take place. Even within that less amount of gap, there is relativeness. That is, if there is very little gap, then direct lamellar bone will form. If there is a little bit of gap, then first woven bone will be formed, followed by lamellar bone. And if there is no gap at all, none of the intermediate stage will take place. Directly healing will occur.